Good morning, I'm Mabel Jong and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. and we are looking at day 2. I'm so pleased to have in the studio with me Pamela Cipriano, who is President, American Nurses Association. Good morning, how are you?
Mabel. Great, good to be here.
It's great to see you. Well, first, give me a little background about the ANA.
The American Nurses Association is the premier organization for registered nurses in the United States. Mm-hmm. We represent the interests of 3.1 million registered nurses, and so we have nurses in every state and territory who are members. We primarily really focus on how do we strengthen nursing to have the best healthcare system in this country.
And how are they affected on the ground by all of the reform that's going on in the sector currently?
We've been very supportive of the reform efforts because we really believe that the two most important things we need to focus now are improving quality and decreasing costs. We know the costs of our current health system are unsustainable, and we know the American public deserves better quality. And nurses are really a key ingredient in improving that quality.
Absolutely. These are the people that patients interact with primarily when they're in a hospital setting or seeing their doctor and so forth.
Really just about anywhere, you're right. And we think of nurses as really the front line of not only support but prevention of disease, prevention of complication, really focusing on how do we keep people well, how do we make sure that their needs are being met, and then also how do we provide the complex care when someone does find themselves in a hospital. So nurses are everywhere that care is provided, and they're really providing services beyond what money of the public even recognize.
We speak a lot about providers and physicians being involved in this process, taking a more active role and leadership role in the change. Do you see nurses taking more of an active role as well?
Absolutely.
And in what way?
Thank you. Absolutely. The Institute of Medicine issued a landmark report in 2010 called Leading Change and Advancing Health, the Future of Nursing. And they really have put a stake in the ground to say nurses need to be a much stronger part of leading this change and helping to transform healthcare. So we're doing a number of things. First of all, we are trying to make sure nurses are well prepared to be able to serve on boards. We know that boards in this country, whether they're health care organizations or other boards, are really driving some of the decisions. So that's really important. We're getting nurses appointed to federal decision-making policy committees so that we can again influence the direction of healthcare. But really a lot of it happens at the local level, working with our healthcare organizations, working with patients and consumers, working with our local legislators to make sure that we have care that makes sense, that nurses are included. We're working across our states to make sure that there's no barriers to practice, particularly advanced practice registered nurses. Mm-hmm. We believe it's important that they have full scope of practice, and we think that's important for all registered nurses because we can contribute a lot of care that again sort of reduces delays, provides better access, and provides more focus on wellness.
And for years we've talked about the shortages being covered by the nurses, the shortages in physicians, I should say, being covered by more nurses on the ground. Is that still a trend that we're going to be strengthening in the years to come?
Well, one of the things that we're very proud of is that there's been more than 25 years of research that demonstrates that advanced practice registered nurses can provide care with similar outcomes to physicians in many of the primary care areas. And in fact, in many of those situations, they actually have higher patient satisfaction. And that's been supported by the National Governors Association and the Federal Trade Commission to say, let's unleash the nurses because we want that balance. We want to be able to make sure people aren't waiting for care. So it's really an overall team approach. It's not that we think there are shortages that are the only reason that we need to have this full scope of practice, but really saying, you know, there are so many services that individuals can provide, and nurses can provide a lot of the same services that physicians were providing. But we also believe it's true for other healthcare providers. We want everyone, whether it's a pharmacist or a nutritionist or a therapist, to be able to have full scope of practice.
Now, I understand that the ANA has branded 2015 as the Year of Ethics. What does that mean?
Oh, thanks for asking. We have just issued the revised Code of Ethics with interpretive statements for nurses. We've had a code for 65 years. It guides everyone's daily practice. It's really a stellar bedrock of what nurses believe and how they need to interpret challenging issues and how to be able to protect self-determination for patients as well as make the very best decisions to provide care. So this provides a roadmap, 9 provisions as well as the very extensive interpretive statements that talk to our role in leadership, that talk to being able to solve dilemmas that maybe weren't here 10 years ago, such as some of the decisions that need to be made based on technology and other advances in care.
Mm-hmm. And Pam, what's your message at this conference this year?
Two things. We need to make sure that we, again, have full scope of practice authority for all registered nurses. So based on education and training, we want nurses to be providing care everywhere. We want them to practice to the full extent of their abilities, and that is, again, complementary to the rest of the team. So that's something very important. The second part is we want to make sure that, as we know the healthcare dollar is being squeezed, that we are not fearful of protecting the previous fee-for-service and the traditional reimbursement. We may need to support the fact that hospitals have to close if we really are going to move from an illness system to a wellness system. That may mean nursing jobs are put in jeopardy. So what we want everyone to recognize is that while we're in this transition, first of all, don't cut RN staffing in hospitals. They are the most important front line of defense to prevent any kind of complications and keep patients safe. And ultimately, though, help us move nurses from hospital settings to the other outpatient and ambulatory care and home settings where they will make a difference for the future in a transformed healthcare system.
Okay, Pamela, thank you so much for that last word.
Thanks, Mabel. Appreciate it.
Your time. And I'm Mabel Jong. Thanks for watching.